welcome today. So my name is Dr. Louise Newson. I'm a GP and menopause specialist working in Stratford-upon-Avon in the UK. I'm also very interested about education about the menopause and how it affects so many women. So I'm very excited today to have a great panel today, and really excited actually that I've got a man on the panel too to be talking about the menopause. So thanks ever so much, the three of you, for joining me today. And before we get started, what I really wanted to do is just to spend a minute or two talking about the menopause, what it is, because there's such a taboo associated with the menopause, and many people don't really even know what it is. If you ask people, they'll often say, oh, it's just an old age problem, or it's something that happens to older people and it's just a natural process, and maybe it causes a few hot flushes, and that's about all they know. And all of those things are true, but actually there's more to it. So if you look at the word menopause, meno is menstrual cycle, so periods, pause is stop. I've done a lot of work with the West Midlands Police, and they told me once it means men pause, men get away from me, which is actually something that is laughable, but it's sad because often it does happen. Relationships fall down because of the menopause, but it actually is a look back in time diagnosis. It happens when women haven't had a period for a year. A lot of women experience symptoms before their periods stop, so these are perimenopausal women, and we need to include these women as well when we talk about menopause, because there are a lot of women who have symptoms for sometimes a decade before their periods stop, and they're experiencing symptoms. And when we think about symptoms, we have to understand that the hormone, especially estrogen in female body, affects cells everywhere in our body. So not just our reproductive organs, but essentially in our brains, in our muscles, in our joints, in our skin, in our cardiovascular system, in our bones. And the importance of knowing that is because without this hormone, lots of our systems get affected. So hot flushes and sweats can occur, but the most sort of disabling symptoms that occur are symptoms such as memory problems, fatigue, brain fog, concentration problems, low mood, anxiety, and then people get muscle joint pains, they get headaches, migraines, urinary infections. The list goes on, and you can see why it's so important that we talk about it, because without the hormones, all these symptoms can occur in women, and we know around a quarter of women have severe symptoms. So this means these are symptoms interfering with their quality of life at work, but also at home as well. The other thing to really just to reiterate before we get started having a discussion is to really just let you know, and I'm sure a lot of you do know, that the menopause will last forever as long as we live. And you can argue maybe that it's not natural to have a menopause for a long time, because if you look back in time, women used to die quite soon after our reproductive time, so in our 50s, and now thankfully we're living for longer. So to have decades without our hormones can be a real problem, and this can lead to health risks. So risks such as heart disease, osteoporosis, diabetes, dementia, all increase because of the low hormone levels. And the menopause needs to be thought of as a long-term hormone deficiency. And because of this, it's really important that we get our treatment right, we get our education right. And for me as a doctor, it's very important women are given individualised help and support. We're all different. Our experience of the menopause is different, but our way we approach it is often different as well. But sadly, we hear too often that women are not given the right information and not the right choices to be able to go forward and make the menopause a really positive experience. When I was working with West Midlands Police, we did a survey, and we showed that 78% of women had had symptoms affecting their ability to work, and around 20% had given up work. Around 50% had thought about giving up work. This is really sad, and the average age of the menopause is 51, but around 1 in 100 women under the age of 40 have an early menopause. So it isn't an old person's problem, and we're all working harder, working for longer. And actually, I love my job. I don't want to stop when I'm 51, if that's when I go through the menopause, but actually I was experiencing perimenopausal symptoms in my 40s. I've got to the stage where I was forgetting the dose of paracetamol. My memory had gone, my mind had gone, I was anxious, I was getting back-to-back migraines. I would have had to stop work if I hadn't received the right help and advice, which is actually quite hard to access access. So I'd like to just bring in Paul here and ask him about his experience, because Paul works as for NHS employers, and he's head of human resources and diversity there. And the menopause is still a taboo in the workplace, Paul, isn't it?
It is, unfortunately, Louise, very much so. And thank you for contextualising the subject, because I think it's really important. And actually, if I can just contextualise, excuse me, if I can contextualise the NHS, I think you'll realise how important it is to us. So the NHS employs 1.5 million staff. We're the largest employer in the UK. We're the largest employer in Europe. And we're the 5th largest employer in the world. So I think, and I know lots of my colleagues think, that we've got a great responsibility to be a good employer, which is what we try to do. More than that, 77% of our staff are female. So even more reason why a subject like the menopause is something that needs to be discussed in the workplace. And as you say, Louise, it certainly isn't discussed enough. So I'm really pleased that we're having this conversation today.
And it is so important, isn't it? Because it affects all of us, but actually a lot of women don't realise that they're going through the menopause. And certainly a lot of the work that I do with education is not just looking at menopausal women becoming educated. I do some campaigning with someone called Diane Danzebrink, and we have she has a hashtag Make Menopause Matter campaign, and we've actually got menopause education into secondary schools, which is a great achievement. Because a lot of people working in the NHS, it's hard work. It's really hard work. And certainly when you're working hard and you're more tired, you're more stressed, you've got so much going on, you think it's due to your work. And maybe if you're in your 40s, you think, well, I'm not as I was when I'm in my 20s. And so you can see how people are blaming other situations, and often they've got children or elderly relatives, pulled in lots of directions, and as females we are usually, not always, but we're usually the ones that are cooking the meals, doing the washing, everything else goes on at home. And I often think how hard it was for me, but actually my job as a GP, I was finishing at sort of 6, half 6, but for nurses who do 12, 13-hour shifts, it's so hard, isn't it? And so much easier to just throw in the can and think, you know what, I can't carry on, and blaming almost the NHS when actually it's probably their perimenopause or menopause. I don't know what your experience would be about that, Paul.
Yes, absolutely. I mean, I think unfortunately it's a symptom of the public sector. You know, there is this tendency to work beyond your hours,
yes,
and almost to expect to work beyond your hours without compensation in lots of situations. So it's very much what you know reflects what you just said, Louise, I think.
Yeah. And I felt when I was with West Midlands Police, I was with them for a year, and they've got this great group. It was a menopause group of women that came together, and very inspirational work. And I went at my first meeting just to educate about the menopause and to give them information about treatment choices, including HRT. And I was very sad to hear how many had given up work or reduced their time at work. They'd often had shorter shifts, or they'd gone off the beat maybe, or they were thinking about retiring early. And the majority of the women I spoke to had been given antidepressants and had been refused HRT. And so I went in, and as a doctor, I can't advise about HR issues. But then I found that actually what they wanted was information. So what they didn't always want is to have more and more policies about reducing their work or reducing their hours or changing the air conditioning. Actually, what they wanted to do was feel better and carry on with their life. And what was wonderful for me as a doctor was the more education I did, the more I could help empower them so they could go back to their doctors and receive the right help and treatment. And by the end of the year, it was amazing. The last meeting I went to was standing room only, but a lot of women had helped other women to get the right treatment. And a lot of them had then stopped taking their antidepressants and really felt better. So I really feel that giving women the right choices in the workplace so they can get help is almost more important than having lots and lots of policies to help menopausal women, because they shouldn't be labelled as menopausal if they have the right help and treatment. And I'd like to bring in Marje, if that's okay, because you're a great advocate for women, and I know you've experienced an early menopause as well. So what are you thinking of what I'm saying? Are you agreeing with what I'm saying?
Absolutely. I mean, I have actually budded some friends and friends of friends that just haven't had the confidence to go to their GPs, for instance, because, or they've already been to their GPs and they were sort of shooed away. And there's a great lack of, I just find that there's a great lack of trust actually between both for the clinician as well as for the patient, all around HRT, whether or not to take it on, and so yeah, I mean, everything that you're saying is completely true. That there does need to be more of a conversation, more of a for both clinician and for patient to improve the information that gets out there, so that people can actually manage menopause better. As you've pointed out, there's so many health risks long term, as well as some symptoms that are just unmanageable to be getting on with day to day. And it just really just brings us down as women.
Absolutely, and I think it's almost easier if you're a pregnant person and you've had a really bad sleep and you go into work the next day and you say, gosh, I'm really exhausted, I've been up 3 or 4 times, and then people will offer you a chair or a cup of tea and talk to you. Whereas as a perimenopausal or menopausal woman to say, I've been up a few times in the night, I feel really tired, it's just not going to do it, is it? And I think a lot of women are worried it's going to delay them even being promoted at work or taken seriously at work. And if you were diabetic or even depressed, it's almost easier. It's fantastic now we can talk about mental health and well-being in the workplace. And I think, Paul, for your role with health and well-being, it's so important. Companies are realising that if their employees are happy and healthy, then they're going to get more out of those employees as well, and less sickness, which is really important. And I've been doing some work with the Department of Health about trying to improve menopause care, specifically in the NHS, because I think we should be a role model. As you say, we're a massive employer and we really need to look after our staff. We know that nurse recruitment and retainment is at an all-time low, and nurse retainment is huge because we're losing a lot of nurses in their 40s and 50s. Especially if you look at practice nurses who traditionally are a little bit older, a lot of them are going partly because of the stresses of the job, but a lot of it is because they're menopausal and they don't know how to get the right help. And I think it's just so key that we can provide the right information and knowledge for them to go forward. So, I mean, Tamara, what is your experience with your Live Better with Menopause site? Because I know you must be in contact with a lot of menopausal women who presumably are struggling with their symptoms.
Yes, we are. We've probably had about 15,000 women who are using our site, and I think I can only echo what you say. I think the biggest search is for information. And we've been going properly for about 18 months with supporting menopause. And the main thing is, what can I do to actually bring some relief from these symptoms and side effects, rather than how do I adapt life just to living as if I have the menopause and that's that. And what we found is that the kind of information that's really helpful takes on a number of different forms. So from the beginning, sort of, how do I know that this is perimenopause or menopause rather than something else? So it could be that there's some really obvious side effects that people often talk about, or it could be just something, I'm extremely tired, my eyes are dry, or a range of symptoms that nobody can quite put together and say, oh, that's that. So often the first point of information is, what is it? What are the common side effects and symptoms, and how do I know that I'm in that stage and that's what I'm going through, as opposed to anything else? And from there, and the best form of support is coming in two forms, really. It's just articles sort of saying, here are all the things that you could be going through. Does any of this resonate? And if so, you're not going mad, or you're not, even if your friend is the same age, feeling they know they're in the menopause and they have completely different symptoms, it doesn't mean you're not. And so what is everything that you could be going through? And then secondly, user stories, other people going through the menopause really, really helps. So we do a lot of sort of Q&A, a lot of my day, my week, how I cope with the menopause and going to work. And then what we hear back is, oh, I found, that paragraph really resonated with me, or this tip really resonated with me. And it's having enough information out there that people can pick and choose what's actually relevant to them. And then the other side of it is then going through sort of once you know what you're going to do, you've sort of identified that this is something that's really relevant to you. Then for each symptom and side effect, what is it that other people are doing to help to make themselves feel better, whether it's little tips or things that can bring relief. Or you mentioned, Louise, about brain fog. Okay, well, what can cause that? It's why am I getting this? And then are there any tips I can do? Can exercise help? Can nutrition help? Can all the things you hear about brain exercises, is that actually going to make a difference? And what has worked for whom? So I think a lot of peer learning, a lot of sort of woman-to-woman support, and then some expert advice that just says, this is real, each of these symptoms and side effects are real, here's what we know about it, here's what's fact. And I'll just have one more thing, we do a lot of here's what's fiction as well, because there's a lot of myths out there, there's a lot of sort of try this, it could help. There are things, if we don't advocate for something, because everything we have, it has to be reviewed, so somebody credible has to have said that, yeah, this is a real deal, we will not talk about certain things, and then we'll write about why we're not talking about them. This may be something that you read about on lots and lots of forums, but the reason we're not talking about it is because of XYZ reasons. So just trying to separate the sort of the myths from what can really help. I think
it's sadly it's a big market out there for menopause, and it's very important for me that women receive evidence-based and unbiased information. And as some of you know, I have a website, menopausedoctor.co.uk, and it's full of evidence-based and unbiased information with lots of downloadable fact sheets and resources. And also I record a weekly podcast, so I'm involving lots of key experts in their field. But it's very important that women are given the right information, because sadly it's too often that I see women who are given the wrong information, and therefore they can't make the right choices about their future health and care. And menopause care in the NHS is actually shockingly bad. And so we have really good guidelines from the Faculty of Occupational Medicine about menopause care. And one of them is to say, if you are struggling, then you, as a woman, you should go and seek help. And too often I speak to women either directly by the work I do or indirectly through social media, and they have tried to receive help and they are given the wrong advice that's on outdated guidelines or evidence, and there's a lot of confusion. But I'm not going to go into it in detail here, but for the majority of women, there are more benefits than risks from giving HRT, because it's a long-term hormone replacement is all we're doing, and replacing those hormones can help symptoms, but also it can reduce future risk of heart disease, osteoporosis, diabetes, dementia, the list goes on. So it's very important that women are given the right help. And I just feel that as an NHS employers, we should be looking after women more. But it's not just women, is it? Paul, men are affected too. I've done some work with West Midlands Fire Brigade, and we know from good research that actually men who have regular intercourse, for example, have actually, if they have sex, I'm sorry to talk about sex on a panel, but if they have sex at least twice a week, they have less blood pressure problems, less heart disease, less diabetes, and actually they have better performance at work. And so I'm not saying sex is the only answer, but what I am trying to say is that a lot of women I see, they have very low self-esteem, they have low self-value, self-worth, and so their libido is low, but not just about having a sexual encounter. They don't want to touch their partner's hands, they don't want to hug, they've lost any form of intimacy. So partner, male or female partner, who comes home to this perimenopausal or menopausal woman often will say, they're not the person I married. Who are they? And the woman's saying, well, I'm someone else. I love them, but I actually haven't got any feelings, and I feel so low and flat. I'm not motivated. I'm joyless. And so you can see that for men, it can really affect them too. Yet often in the workplace is where, I mean, I see my colleagues more than I see my husband because I work such long hours. So actually for men who are at work, how can they go into work and say, yes, my relationship with my wife is dreadful. It's really affecting me. So I don't know if you've got any thoughts about helping men with the menopause, Paul. So.
No, absolutely, yeah. I mean, it's really interesting listening to Marje and Tamara. I mean, that phrase education, education, education comes to mind, you know, and it's so important. And one of the main ways in which NHS organisations are trying to increase the level of knowledge and awareness about the menopause is through menopause networks. So lots of organisations now are setting up menopause networks, and these aren't exclusively for women. So we talk a lot within the world of diversity about the power of allies, you know, whether it's in the field of disability, race, gender, and it goes for menopause as well. You know, those people who, as you say, aren't immediately affected by this, but who have got a role to play. Yes. In this are really important, and it's important that they understand it. You know, I've learned so much more today about the menopause than I ever knew before.
Great.
I came onto this call. So, but on a serious point, you mentioned social media, and I'm like you. I'm active on social media, and I talk a lot on social media about a range of diversity issues. I can probably count on one hand, and less than one hand, how many times I've had a conversation online about the menopause. Yeah. It just isn't something that people either talk about face to face or talk about virtually either.
It's not very sexy.
So carry on.
It's not very sexy, is it?
No, I think there is a big taboo. I know when I set up my menopause clinic, it's called a Menopause and Wellbeing Centre, and someone I worked with at the time said, I really disagree that you shouldn't have the word menopause, you should put it a women's centre. And I said no, because my work is about the menopause, and I've stuck to my guns. But people do misinterpret the menopause, and I think it's really, really sad that people don't have this understanding. But then if it's not spoken about, how do we understand? You know, we're not prepared for it as women, and actually for employers, how do they know about it as well? And then for partners, it's very difficult as well, because I see a lot of partners in my clinic, and they come with their wives who are the patients and say, I don't know what to do. I really don't know what to do. I thought it was me. I thought it was because I'm working long hours, or because we've had children, or because. But actually they said I had no idea. And it's the psychological impact that is the impact that has the biggest effect on women. And it's no coincidence that the peak in suicide in women is in the early 50s, and the menopause is in the early 50s as well. And certainly I see a lot of women who have considered suicide in my clinic, and it improves with the right type and dose of hormones, because the power of hormones in our brains to have connections and to help with us feeling happier is so important, that is often neglected. So it's very important that women have education, but it's also very important that healthcare professionals have education as well. And I had no formal menopause training as an undergraduate or postgraduate, yet the menopause affects every system of the body, as I've said. So, you know, heart specialists, brain specialists, bladder specialists all need to be taught about the menopause in an evidence-based way. And this is something I am doing a lot of work behind the scenes with. I'm partnering with a company called 14 Fish to deliver a menopause education program, which will be available to doctors, nurses, pharmacists at a very low cost, but it will be evidence-based, and it can be part of their appraisal and PDP, because there are so many medical people, clearly, who work in the NHS. And if we can educate them, they can educate others. And it doesn't always have to come from a GP. It could come from any specialist or any nurse, any healthcare professional. And so certainly I feel that the education really needs to be at the root for women, but also for healthcare professionals, so it's married up. I don't know what your thoughts about that are, Paul.
Yeah, I mean, we talk a lot in the diversity field about lived experience, and that's the sort of terminology that we use. And as you say, there's nothing more powerful than hearing these stories from someone who's been affected by them. Whether it's a professional or some other source, I think, a good source of experience is always helpful.
Absolutely, and I think that is so key. When I educate, pre-COVID days when I used to lecture, whenever I've lectured nurses, I've had the biggest response. And actually, quite a few lectures I've been running out to my car because I've got to go and pick up my children, and I look behind and there's a whole load of nurses asking me questions, and it's usually about themselves, because they have this light bulb moment when they hear me talk and say, my goodness, that's why I've got low mood, that's why I can't remember anything, that's why I can't sleep, that's why I've put on weight, that's why I'm getting up 3 or 4 times a night to go to the toilet to pass urine, that's why I've got no libido. And no one's really thought about it and put it together. And then for me, as a healthcare professional, obviously I worry about all the money that's spent on the NHS. And if you look at the figures, for example, £2 billion a year on average is spent on hip replacements due to osteoporosis. 1 in 2 women over the age of 50 who are menopausal will have an osteoporosis, and 1 in 3 will have a hip fracture. We know that taking HRT reduces that. So if you look at even just saving money on osteoporosis prevention, but also taking HRT reduces the risk of a heart attack by around 52%. It's more effective than statins and blood pressure treatment, yet no one has HRT, about 10% of people. So we need to be looking at the cost of the health of the nation. And then you look at figures such as migraine. I think it depends what you read, but I read somewhere about £22 million a year is spent on absenteeism from work from migraines. Migraines are far more common in menopausal and perimenopausal women because of the estrogen effects, yet no one thinks about it. So actually we can be really clever by giving someone low-cost treatment that can make huge health benefits and cost savings as well. We're all very conscious of costs, and especially now with COVID, we have to be really careful, don't we, about how we're going to spend money in the future. And what we don't want to do is save our costs by getting rid of staff. We want to have our staff, we want to retain them, but we want to keep them very productive. And ways that we can do that has got to be looking at the menopause. And it's not all about HRT. I understand that a lot of women can't take it in the first instance, especially if they've had an estrogen receptor positive cancer, although some women still do take it because of their quality of life issues. But we need to look at exercise, diet, well-being as well. There's no point me taking HRT and sitting on the sofa every night, smoking 20 a day and eating chips for my supper. It's not going to do it. But it is important, isn't it? I'm sure you agree, Marje, about looking at all of us, the whole well-being side as well, isn't it?
Absolutely. I mean, just picking up on your point about, again, it's about education, isn't it? It comes back to, before I knew I was coming on this panel, so I gave a call to my friend who's training to be a GP. I said, how long do you, what's in the curriculum for all around menopause? And he said, it's a voluntary session and it's 2 hours. His course lasts for 3 years. And so that's the amount of information that the clinician gets. And then you look at, you're talking about all of these, the cost benefit to the NHS. If there was a bit more of an uptake in HRT, for instance, but still the health economics hasn't been, it's quite patchy around what's for long-term health risk reduction. That hasn't been done. So that, again, there's very little information, very little data, very little money really being put on. I'm hoping that as our voices get louder, you know, with campaigns such as Menopause Matters and other really kind of quite strident ladies coming out there, you know, these gaps of knowledge will be bridged. But we also have to think about those. So going back to what all around the sort of the BAME communities as well. The information is not getting out to them.
Absolutely, and I think that's very important. Some of you might know I've done a podcast with about this very issue with Nijat Arif, who speaks very much for her community, and she talks so much about it being under the veil, and there's not even a word in Punjabi, I understand, for the menopause. And we see it a lot in women from ethnic minorities and certain places in the world. For example, in Dubai, they can't get HRT, and it's quite scandalous, I think, and it's very hard. And if we look at some of the other symptoms that can affect women, they're being mislabeled, and then they're too scared to talk about it. So they're not going to talk about it at home, so they're certainly not going to bring it into the workplace to talk about. But actually, I don't know if you agree, Paul, but maybe the workplace is a safer place for them to talk rather than at home about the menopause.
I think it is very much. I mean, or at least it should be anyway. And this is why, you know, I mean, we encourage networks a lot for lots of different subjects, you know, special interest groups, you might call them, in the workplace. And they can be very, very powerful. You know, Marge talks about the power of voice. And it is really, really powerful when you get a group of people together on a common cause, and you give them license to influence the organisation, that often they'll take that, and we've seen some fantastic results from that. So we're very supportive of you know, that whole empowerment process.
Yes, and I think it's very important, isn't it? Because I know the work we did in the police, some people were criticising us to say, well, they don't want to be talking about their menopause. To them, it's a very personal issue, and they shouldn't be encouraged. But actually, no one's being forced, are they, to talk about it? But I think what it is good is to drip feed information and have a safe platform, whether it's a face-to-face or it's online, where people can share experiences and learn from each other. And I know in West Midlands Police, they were putting signs on the back of every toilet door, and it was a picture of a woman, and it had lots of words. It was a pictogram, lots of words of symptoms. And I thought this was an absolutely fantastic idea. And then one of the police officers said to me, Louise, do you know what? Every time I go to the toilet, I cry. And I said, well, what do you mean? And she said, well, I am that menopause woman. I have all those symptoms, yet I don't know how to get help. And I thought, this is really sad. It's good because it's the first step of acknowledging that she needs help. But actually, it's knowing where to go for help is really important. And like everyone's saying, having the right help is what is crucial, because sadly women are given the wrong help, the wrong advice too much, and then they're scared to ask and talk about it. And the menopause doesn't go away. I always say to my patients, you don't get a medal for battling through with symptoms. No one's going to congratulate you. You know, our life is not a rehearsal. Every day might be our last day. We've got to make the most of it, and we all make choices based on risks, you know, the type of car we buy, the way we cross the road, but we do it because we have to get on and do things, and so it is important. But I think the more evidence-based information women have and men have about the menopause, about what it is, about the treatment choices, is really going to help, whether it's in the workplace or not. I'm sure you all agree.
But also, I mean, just back to Paul's point, that lived experiences, as you were saying, Paul, and but having a representative voice. So, you know, as Louise knows, there's been a real great deal of work over certainly for the last 2 years. I've seen just kind of, you know, a huge upsurge in information that's getting out there, but it still comes from quite a, you know, sort of middle class, privileged voice or representative. certainly within the NHS, I think that there's massive scope for women of colour to stand up and say, look, this is what I've gone through. This is what, you know, helped me, and you know, bring it back to their own culture as well, to be able to speak to that.
Absolutely.
Every
yeah, and I think that's so important for any of you who know about the work that I've done. I do it on a complete shoestring. I'm not funded. Not paid by pharma at all in my work. I don't have any sponsorship. So my website cost me a huge amount of money, much to my husband's annoyance, but it feels like the right thing to do. I would love to get some funding to have it translated, for example, into some different languages, and certainly we're developing this app called Balance, and we're hoping we can get some funding to get it translated. But then there's other minority groups as well. I'm doing some work with HIV charities, and women living with HIV gladly are living longer, but then they become menopausal and they have these symptoms, and they're less likely to get HRT. We also have done some research showing that women from lower socioeconomic groups are less likely to be offered HRT, about half as likely. So it's really important it's not seen as a middle class problem, because actually women who have from certain ethnic groups, but also from lower socioeconomic classes, are actually more likely to have heart disease and diabetes. So actually they can benefit more from having the right treatment, including HRT. And HRT costs the NHS about £4 a month. It's very, very cheap. So it shouldn't be something that only the privileged can access. It's absolutely scandalous that people have to even pay to come to my clinic. But as I said, I can't get a job in the NHS. So, but a lot of the work I do is people come and then they go back and receive their treatment from their GP, who then feels more confident to prescribe. So there's so much that needs doing. I don't know, we've just in the last few minutes, maybe I could just go around you all and can you give me just a couple of ideas that you think maybe would make the biggest impact to improve the most women, because that's no mean feat. So let's go with Tamara. Have you got any ideas what we can do?
I'm trying to think of things we haven't already said. There's obviously everything we've said about information, everything we've said about sharing. I think one thing is the reasons why menopause can strike at different times of people's lives. And another condition we focus on, for example, is cancer. And we have a huge number of women who have gone through different types of treatments, and so therefore they're going through menopause quite early. That, if you think of all of the things we've talked about in terms of feeling isolated, not really having information and all of that at the more usual stage of life, sort of mid-late 40s and onwards, it's only enhanced when you go through something you're definitely not expecting to 10, 15 years early. Women going through a hysterectomy or whatever it might be. So I think my one thing would be considering, we've talked about underrepresented groups, considering that for those who are going through something else that has therefore caused the onset of menopause.
Very good. Excellent. Yeah, and I think that's very important. I've been doing these Instagram lives just to try and help people during lockdown every Sunday, and I did one the Sunday before last for women who have had cancer, and I was overwhelmed, saddened and very humbled with the questions that I received and the comments from women who have been struggling because they haven't received the right help, and it's completely wrong. So Marje, have you got any thoughts how to help women?
Well, I see, and I'm honoured to sort of come across quite a few of these startups that are looking at, sort of the future of trying to manage menopause and its risks as well. So going back to what we were saying before, which is, what's the number one thing that people are scared about, treating effectively the menopause, and that is the cancer risk. And so perhaps offering more confidence in the treatment for both patient and clinician, because clinicians have to be the ones that are prescribing and trust in what they're prescribing. So and with this coronavirus, if anything that is taught us, a lot of things are necessary now to be done at home. So more at home sort of screening, testing. I think there's even a startup that's got ultrasound via your iPhone. That kind of thing. I know it's a bit wacky, but but the confidence to be able to take on HRT as it is the only real effective treatment there to reduce those symptoms. I think that's the way forward, really, just to give confidence.
Absolutely, and I think educating yourself is really important. And just to avoid confusion, there is no diagnostic test for the menopause or perimenopause. It goes on symptoms alone, especially if women are over the age of 45. So any company that's offering you a blood test or a urine test to diagnose your menopause, please do not spend money on it. You just need to download a questionnaire. There's one on my website. If you Google, you put questionnaire in the search engine. That's a validated menopause rating symptom questionnaire. If you have symptoms that are changing and your periods have changed in nature or frequency, or your periods have stopped, then you should seek help and get the right help and advice. So Paul, what about you? I obviously not just about women, but men, but in the workplace. What do you think for the NHS? What could they do that would be cost effective and have maximum impact to help menopausal women stay at work and get the most out of them at work?
Yeah. I think there's two things that they can do. I mean, the one thing we know about all of these areas is that leadership is really important. And often what NHS organisations and boards will do is that at the beginning of a board meeting, they'll have a staff story or a patient story. And those are really powerful, again, because they're so personal, and they'll often hit home with people, you know, at a very personal level. But I doubt whether there's very many menopausal stories that are shown at board meetings. So I would encourage organisations to do that. And actually, we've got some videos and case studies on the NHS Employers website, which people can access to do that. And then the second thing I'd say is, and I don't want to sound fickle, but going back to where you started, Louise, you described how menopause is seen and it's viewed. I think it needs a rebranding. You know, we need to somehow find something and a way of describing the menopause in a way that is more meaningful to people, and in a way that is going to engage with them and make them realise all of those connections that we've talked about today, and the ways it can impact on people's, not just their lives, but their working lives as well.
Yeah, I think that's so important, Paul. And certainly I've tried to engage with various colleges about changing it so we think of it as a long-term hormone deficiency, because once you say the word deficiency, people think about replacement. So if I was said to any of you, you're iron deficient, you would say, well, how do I take iron? Well, we're hormone deficient often for decades, so how do we replace those hormones? And we need to shift that to looking at it as a condition. It's a marker for future disease, the same as obesity isn't a disease, but people who are obese have a higher risk of cancer, for example, for heart disease, diabetes. So we need to address obesity, we need to address the hormone deficiency. So I think it is really important, rebranding. We need to get some people thinking about rebranding the menopause, and then we would change. And patient stories are really important. And I think one of the reasons I'm so passionate about helping women is having experienced symptoms only for 4 months made me realise how absolutely horrendous it is. And I know my husband for 30 years would have left me. My job would have gone, and I don't know what I would have ended up doing, because I had so many symptoms. Yet I see women who have tried to survive for 10 years or more with symptoms. So having a personal experience is important. Even on my website under resources, there's a video section, and I've got 2 patients giving their stories, which you can access for free. And if you want, Paul, I can share them so that you can, show them on every board meeting. They don't take long, but from the horse's mouth, it's so important. It really gets that feeling and that light bulb moment for a lot of people, who then recognise it, maybe in their employees, maybe in their work, or maybe at home, maybe it's their sister, maybe it's their mother, but it's very important. So I hope people who have been listening to this panel have enjoyed and take home some good tips that they can share and go forward to help really our generation, future generations, and generations above us to have a more positive menopausal journey. So thanks ever so much for your time today.